This episode of The Matt Feret Show is brought to you by the Brickhouse Agency. Brickhouse is a boutique independent health insurance agency that focuses on finding the right Medicare coverage for folks across the country. Matt's wife, Nikki, is the heart behind Brickhouse. She's great at making confusing things clear and is passionate about helping people find a Medicare insurance policy that suits their individual needs. To schedule a free one-on-one appointment with Nikki or a member of her team, head on over to brickhouseagency.com or simply call 844-844-6565 and someone will help you schedule a phone call or a Zoom meeting. The consultation is free because the insurance companies pay Brickhouse, not you. There's never any pressure or obligation to enroll. Your clearer, simpler Medicare journey is just a call or click away. brickhouseagency.com. Not affiliated with or endorsed by the government or federal Medicare program. Contacting Brickhouse Agency, LLC will direct you to a licensed insurance agent.
Hello everyone, this is Matt Feret, author of Prepare for Medicare and Prepare for Social Security Insiders Guidebooks and online course training series. Welcome to another episode of The Matt Feret Show, where I interview insiders and experts to help light a path to successful living in midlife, retirement, and beyond. Bill, welcome to the show.
Hi, Matt. Thanks for having me. Appreciate it.
So tell everybody what you do, how long you've been doing it, and how you help people.
Sure. Well, I trained as a dentist, and I specialize in the area of periodontal diseases and implants. And so basically, I take care of people's gums and make sure that you're able to keep your teeth for life for as long as you possibly can. And when you can't anymore, and for whatever reason you've lost some teeth, it could be trauma, it could be neglect, it could be genetic disposition or whatever it is, we have methods to replace those teeth to make sure that we can keep your function, your smile, and your speech coherent. So that's what I do, and I've been doing it now for about 35 years. I started out in the United States working in New York City, where I trained. I had the benefit of working with some of my mentors and professors for a few years, and then my family and I moved to Israel, and I've been practicing here, part-time academic, part-time clinical practice, and a lot of research, and frankly, enjoying myself and hopefully providing good things for my patients.
So every once in a while, I'll read an article that pops up that says gum health, or the lack of health, I guess, is ties into so many aspects of the whole body health. Talk a little bit about how accurate that is, or examples of how, gum disease or oral health impacts your overall health.
So I'll share with you a little vignette that I think is actually interesting that just occurred to me as you were talking right now. Many years ago, doctors said that there was an issue that if you had an infection in some area of your body, it would have an impact on your whole body. So for example, if you had a toe infection, you might have infections in other areas that you were not expecting. Well, afterwards, science poo-pooed that idea and really downgraded and said there's no such thing as focal infections infecting the body. Well, as science improved, we found out that they were right all the time. And if you have an infection someplace in your body, wherever it is, it will get into your bloodstream, it will promote inflammation in that area, and the inflammatory mediators, which increase your inflammatory profile, will also increase. And that will impact tremendously across all aspects of your health. It'll impact on, like for example, let's take gum disease specifically, since that was the topic that we started with. If you have gum disease, you have a low-grade infection and inflammatory process going on, which can actually be, if you spread out all the size of the gums across a wider area, it's about the size of the palm of a large hand. So it's not an insignificant sized infection. And if you have an infection like that with all the inflammatory mediators and the hyperinflammation that's going on in that area, you will have an impact on pretty much every disease that we are used to describing. Cardiac disease, increase in strokes, increase even in Alzheimer's disease, increase in arthritis, increase in diabetes. It's across the span. And the reason is you're torquing up the body's negative immune system. You're influencing every disease to make it, whether it won't necessarily initiate a disease, But if you have a cardiac problem, it can make it worse. If you have a tendency to strokes, it can make you have a greater tendency or more likely to get a stroke. If you have Alzheimer's disease, it'll promote it to move faster. So all those things get impacted. It's not just periodontal disease, it's just that periodontal disease affects 50% of the American public over the age of 35. So it's why this disease is so critical to manage, and frankly, why medicine and your family practitioner and your caregivers should always be aware to make sure that your oral health is in good shape so that you can make sure that you're managing the rest of your diseases properly.
Two things you said in there right at the end are shocking. I don't think I've ever been to a primary care physician that's ever asked about my oral health. I mean, if I think maybe if they stick something in my ear and then maybe they ask me to say open up and say ah, is that what they're looking for when they're asking me to open up and say ah?
I wish you were right, but you have to remember, Stephen Hawkins talks about the black hole. So think about what the mouth looks like to a physician who's used to looking at you. Open it up, my God, it's dark in there. So I can't really see a lot, so I'm just going to ignore it. And that's a lot of what happens. In other words, when you open up the mouth and you're used to looking at it, you will see the inflammation. But unfortunately, most physicians find it easier to not really address that aspect. They're not that familiar with it. They did not get a lot of background in medical school, because what happens is dentists and doctors go to school together for the first 2 years and study the basic medical system, and then they divide up. So doctors don't really get a lot of information about dentistry. And actually, I'm fine with that, except that they should be aware of the connection from an inflammatory perspective. And if someone's going to see or someone has a cardiac problem that's being managed, he should have been given that advice. And it's the way of treating that patient properly. Same thing with everything. So I think doctors are a little remiss. Not every doctor, obviously. There's some very conscientious doctors, but I think that's an area that is going to be increasing in terms of awareness. And interestingly enough, it's being driven by the public media more than the medical literature.
Oh, wow. Well, what about my dentist?
That's interesting.
Does my dentist check me out, or does he just clean
Your
my teeth?
dentist knows about it, but he's busy taking care of your oral health, so he's doing his job. But he's not going to say to your doctor, hey, you should be telling Matt what to do.
When I go in for a checkup, is the dental hygienist or the dentist given a cursory look at least, or taking a peek, or are they just in
It's
now?
a very good question. It's a very good question. In other words, theoretically, what you should expect from both the hygienist and the dental practitioner, you should expect them to look around your mouth and check out the oral tissues to make sure that there's no lesions that are there, because you can have in the mouth skin diseases like autoimmune diseases of the skin. You have them in the mouth too, and she should be checking for all that. She should be checking for pathology, potential cancer. There's a lot of oral cancer. She should be checking your tongue and the back of your mouth, the pharynx, and all the area around it. And as well, she should be addressing the inflammation around your teeth. And the hygienist is always doing that. Most dentists do as well, but sometimes they get focused in for treatment or two on fillings and crowns or whatever it is that you need. But overall, most dentists are looking at your gums as well and hoping to manage that as well. And that's the right way to do it.
If they don't say anything when they're in my mouth, should I ask?
Yes. It can hurt. Dentists, I think most dentists appreciate being asked, because, hey, Matt, thanks for reminding me. You know what? I'll take a closer look. So I think it's a good idea. And I think it's just making sure you're taking care of yourself.
The other thing, thank you. The other thing you said was 50% of US adults have some sort of gum disease. Did I get that right? Did you say that?
You got it right. And I'll add one more word. 50%. And this is Center of Disease Control, and the numbers are increasing steadily. Nobody's exactly sure why, because there is a greater awareness of oral health, but the statement that I will make now with the added word is 50% of the American public over the age of 35 have significant gum disease. In other words, gum disease gets divided up into two categories. Let me sort of step back, and I hope it's not too tiresome, but basically what happens is your mouth is normally filled with bacteria, but the teeth are actually anchored into your jawbone. Right? Yeah. That anchorage between the tooth and the jawbone needs to remain sterile and protected. It's an internal system. It should not be exposed to the external environment. So the body protects itself by having a special ring of protective and very, very immunologically active cells and sealing off the neck of the tooth so that the inner aspect can be fused to the bone, but the outer aspect will function in the mouth. And that works well, except that if there's too many bacteria there, or if there's some other instigating factors, the mouth will respond, and appropriately so, it will respond with an inflammatory response to control that infection. Now, what happens is, if it's abused, if that protective system is abused, and there are too many bacteria for too long of a period of time, or if you have a genetic predisposition, or if you have a concomitant disease like diabetes or some other diseases which might weaken your immune system, then what happens is you stress that system to the point where it becomes like a computer, which you've opened up too many programs and it's frozen. It's still working, but it's sort of making noises and not really doing anything. So that's what's happening in your inflammatory system. While instead of protecting you, it's firing on all guns. So it's really going wild, but it's not controlling the problem. And what happens is it starts to destroy the local tissue and causes periodontal disease. So periodontal disease technically is when the fusion of the gum and the bone to the tooth gets destroyed. And what happens is the tooth looks normal, but there's actually a gap that develops between the gum and the bone. We call that a pocket because it looks just like a pocket. There's an outside piece of tissue, but it's not really connected to the rest of the shirt, okay? Now, or the tooth in this case. So let's say you have a lot of bleeding and a lot of inflammation and swelling, but it's actually functioning. That'll be okay. It'll last for a period of time because the seal will remain intact and non-disturbed. That's reversible. You brush your teeth a little bit, you get a dental cleaning, a couple of other treatments. We use PeriActive. Whatever you need to do to control that, that'll work. But once it goes to the next step where it starts to destroy the bone, then you're on a bit of a cycle downward, and we need to really do some more thorough steps to control that problem. Okay?
Yep.
So I hope I didn't run on too long, but
no, you didn't. This is why I do this. We're hearing from an expert. So I'm going to go back to that 50% of people. I mean, I walk around, not 50% of people aren't bleeding from their gums, thank God. But
actually, most of them probably are, but it's just not a heavy duty bleeding. Okay.
Do they know it?
Remember, you're looking, what?
Do they know it?
Yes, they'll see it on the toothbrush. Occasionally, they'll see it when they're eating, especially something hard. In other words, the tissue is inflamed. It's not dripping blood, but it is when you irritate it or touch something with it, like a toothbrush, it'll bleed. So you'll see blood on your toothbrush, blood when you spit out after you're brushing your teeth. After you're eating, sometimes you'll see a little bit of blood. Those, you shouldn't be seeing any blood. You should not be bleeding. Okay. And if you're seeing any bleeding, you have a problem. By the way, if you find that number interesting, or even let's recategorize as staggering.
I do.
It increases with age. That's the lowest number. That's 35 years. Every decade, it goes up at least 5 or 6 percentage points.
Oh my gosh.
I know it's really it's a major problem. It's not, I wouldn't call it a pandemic because nobody's dying from it, but they are being influenced negatively from a health perspective. And if you think about it, we don't usually think about it because we sort of take our bodies that are working for granted. But the teeth, and it's your smile, it's your speech, it's your way of communication. So if you don't have a healthy mouth and your teeth are moving, I literally had a patient in my office that he said, "Doc, I think I have a problem." And every time he breathed out, his teeth moved out. Every time he breathed in, his teeth moved in. I said, "I think you might agree with me. You have a problem." So the point is that the people tend to take things for granted and not necessarily run for treatment. Listen, dentists have a bad reputation of causing pain. We do our best to not cause pain, but it's a sensitive and inflamed area. Sometimes it happens. So the thing is that we do want to control all that bleeding, and it's like I said, it's not oozing, but if it gets severe enough, you'll be having swellings and infections, and it could be really, really nasty.
When you were speaking earlier, you mentioned the word genetics. How much of this is genetics and how much of this is lifestyle or foods or lack of maintenance and care?
Yeah. So it's a great question. And the answer is nobody really can pin percentage numbers on it. So I would say that if you have a genetic tendency towards it, you have a tendency towards it. You don't have a disease. You can manage that process, okay? If you're blessed with a genetic disposition to not have periodontal disease, you really do have a level of protection. You can have that early stage periodontal disease where you'll have bleeding, but it'll be reversible. But those who have a tendency towards it, and clearly the numbers are high when you look at the statistics, they can manage it. It doesn't mean they're doomed by any form or fashion. It means that they need to see a dentist and a professional, get a clear way to manage this disease. And it's not just going to the dentist, it's daily home care. And that's a critical part. And we should really address that issue, because what happens is our mouths are naturally infected. That's the way the mouth has to be. If we killed all the bacteria in our mouths wouldn't function healthfully. Our body, from our lips through the anus, needs bacteria inside it. In fact, I know this is going to be a shocker as well, but if you take out the weight of the bacteria that exists in the normal human, normal adult male and female, have to be, from the lips through the anus, weighs about 2 kilos.
Wow.
The amount of bacteria, you have 2 kilos of bacteria sitting in your digestive tract. So that's normal. We don't want to and can't kill all those bacteria. We won't function normally. So we have to live with that environment. So in living with that environment, we need to just make sure that we're keeping that teeth and the junction of the gums and the teeth clean and healthy.
You said earlier, and I know I'm hung up on this, but I promise I'll move on after it. The 50% number is still shocking to me. So if it's genetic predisposition, but not, a death sentence, so to speak, is it lifestyle? And I remember you said that 50% of Americans, is it the foods we eat? Is it the lack of routine care in the lifestyle piece? What's your take on that?
Actually, the American statistics are the lowest.
In
other words, it's worse in the European countries for a number of reasons. I think, first of all, smoking has a very big impact on the health of your gums, because smoking will weaken the gums' ability to manage the disease. So in Europe, where smoking is more prevalent, the disease is usually worse. Also, Americans are much more aware of their health than most other cultures. And so they take care of it. So the numbers in America are lower. So I quoted the CDC because it's more relevant to the population that's on the podcast, but the European numbers are significantly worse. And not every country measures this. So
right, yeah, that's the thing, right? You get the health statistics from the companies, the countries that report, or and then some report, obviously fudge numbers. I think we saw that a lot during, or suspect that a lot during the
yes, we did.
Yep. Smoking, you mentioned that. And smoking has been curbed, or is curbing its use over the last several decades in the United States. But I have also noticed where the transfer of the nicotine is moving from smoking into chewing tobacco, and even these, I'm going to probably mispronounce it, snus or snus. Anyway, the stuff that comes over from Europe, that's the non-spit chewing tobacco, because you've got like, big wads of chewing tobacco, but you have dip, and then you've got these other, nicotine pieces. I would have to assume smokeless tobacco is horrible for your gums. Tell everybody how horrible it is, and whether or not, if you're addicted to nicotine, these little nicotine things that you can put in there with no tobacco, are they a better alternative or just as bad?
So it's a good question, and the data is not clear, but there's two factors. The heat together with the smoke. I'm sorry, the heat together with the nicotine is the worst combination for gum disease. Okay, it just increases the penetration and it causes a lot of problems. All tobacco causes problems simply because all tobacco releases nicotine and some of the other carcinogens into your mouth. But chewing tobacco, and you called it snus, I forgot the name of it.
I think it's spelled SNUS.
Yeah, originally from Sweden. And
yeah, right, exactly. That stuff.
Area,
however you pronounce it, that stuff.
Yeah. Do you know what it is actually? It's a little like a tea pad, like a tea dip thing that you have tea in with little tiny glass particles. And you put it into your gums and you sort of mash it down, and it basically causes micro lacerations, and that's why you get a big rush of nicotine into your body so quickly. So when you know what it is, you're a lot less tempted to use it, I think. But all of these packages where you place the tobacco in its raw form, and usually people use it in a specific repeating area, will tend to cause an increase in that spot of oral cancer. And it could be really, that could be life-threatening. So it's, even though you may have less periodontal disease, you've increased your risk to a lot of other issues.
How do I check how do I check my gums at home? How do I
Good
know,
question.
besides,
So-
let's say, spotting, bleeding, or I mean, gosh, yeah, if I'm gushing blood, I'm going to get into the dentist. But how do I know, how do I get in front of this without it getting to any of those points where I've got blood on my toothbrush?
Right. So a look for soreness, sore gums, swollen gums, and bleeding are the easiest ones to notice. You may notice a little bit of redness that's disproportionate. In other words, your gums should be a healthy pink color. I can't really describe it because I don't have that sense of the colors, but it's a healthy pink, and you should see it. If you have a generalized redness around a series of teeth, that's probably gum disease. But sometimes you have a bad dentistry that took place, or an inappropriate dentistry where it doesn't fit exactly the way it should. And there, what will happen is you'll get a very focal area of redness and maybe bleeding in one spot. There, it might be very easily correctable. So, think about checking that with your dentist or possibly a new dentist. So, okay.
This might be an elementary question at this stage, but I'm going to ask it anyway. Are there foods I should avoid? I mean, I've been told since I was a child, don't crunch your ice. You mentioned the heat and tobacco, and then I've also, these things are popping up, right? If you drink scalding hot coffee, that's bad. Are there certain little easy things that we can do or avoid that are impactful to the gums?
So with the gums, it's really just heat.
Okay.
For foods, you want to make sure you maintain a normal, balanced, healthy diet so that your body will function normally. If your body's functioning normally, your gums can be healthy. You want to avoid two things that are too hot that may burn your gums. There are certain foods which have been shown actually through the data to improve the gum health in a statistically significant way, such as green tea. So there are things that are good for the gums. Nobody really has done a thorough research project where they really have looked at all of these types of foods. But one thing that you should be careful of is not having too many strong acids on an ongoing basis. And that's not so much for your gums, it's more for your teeth. Because things like hot lemon juice with a very concentrated lemon may be good for you in terms of increasing vitamin C and other components that your body will use. But the acidic hit onto your tooth can cause erosion of the tooth and wearing of the tooth. And we've seen cases where we've had to rebuild teeth because they've just worn out or almost like dissolved the outer surface, and sometimes all the way into the inner surface from, and I found that lemon juice is the worst offender.
So anybody listening or watching with kids out there that like to impress adults by biting into raw lemons and taking it, tell them to stop.
Yeah. And also tell them once in a while it's actually not bad for you. It's only when you use it on an ongoing basis.
So I'm going to get some practical stuff here. I'm sure, again, these are elementary questions for you, but toothbrushing. Do you brush after every meal? Do you use a certain type of toothbrush, soft, automatic? How does a toothbrush in your daily care factor into gum health?
Okay, so I'm going to divide it up into two: when to brush and how to brush. Okay.
Okay.
So when it comes to when to brush, it's really what you're really accomplishing with the brushing is you're not getting rid of the food, you're getting rid of the bacterial layer that coats the tooth. Yes, you want to get rid of the food. So most people, though, when they wake up in the morning and have a little bit of morning breath, prefer to brush right after they get up as part of their morning routine. And then they move forward and eat breakfast and go on with that. So other people say, well, you're putting dirty food. Food is not dirty, it just is. I mean, and if your teeth are clean at that point, you're not going to have any short-term issues with it. There are those who like to brush after every meal. You can overbrush. So I would encourage using a soft brush twice a day. If it makes you feel better, you can do it a third time a day, but not too much more than that. We also recommend mouth rinsing as well, but I'm going to go back. You asked me about toothbrushes. So most of the time, if you're adept enough and you know what you're doing, a regular toothbrush should be sufficient. But some people don't have the agility or the hand control to really brush effectively, and sometimes that impacts the elderly population, who some of them, or the let's say the adult population, where they have a caregiver brushing for them. For those kind of patients, if they've lost some of their hand control or they have a caregiver, they should definitely be using a electric toothbrush, because the electric toothbrush works for, it brushes for you. All you need to do is put it on the surface. Whereas if you're brushing with a hand brush, you're actually finding the right location, the right angle, and moving the tooth, moving the brush at the same time. And that could be a little bit more, difficult for somebody who's lost some of their hand control. We also recommend strongly the use of a mouthwash afterwards. And there are two different types of mouth rinses, and the reason for that is that when you swish around, you're actually moving like a flow of fluid that's cleaning off the teeth and enveloping the bacteria that are there and killing them and protecting your gums if you're using the right mouth rinse. And so that actually is a good add-on, an important add-on to your normal brushing. So brush with a fluoride-containing toothpaste, brush properly so you make sure you get every area, and follow that with a mouth rinse afterwards. Even though it reduces the fluoride is really dispersed throughout the mouth very rapidly, because it promotes saliva production, so you're getting a lot of dilution right away. So it's the initial contact for a few seconds that the fluoride is sitting there. You can't really keep it on there effectively for much longer than that, even if you try, because the saliva is increasing. But then with a mouth rinse afterwards, what it does is, there are two different types of mouth rinses, three actually. One is a fluoride mouth rinse. It protects the teeth. That's all it does. And that's important depending on what your problem is. If you suffer from a lot of cavities, you should be using a fluoride toothpaste.
Can I
is
stop you there? Even in adulthood, because I mean,
Yeah,
I can remember as a kid,
definitely.
you go to the dentist, they stick the goop, and on you got to wait 5 minutes, and then they go away. But I don't know if I'm getting fluoride treatments as an adult.
So fluoride works by for children. You can actually take a fluoride pill and it'll strengthen the teeth, because it goes through the bloodstream and goes into the teeth as they're forming inside the bone. So when they erupt in, they're strengthened with that fluoride already. But when you use topical fluoride, like you're describing, that goop, that helps throughout life, because the fluoride contact to the root surface and to the enamel, it's sitting there in a concentrated bath for about 3 to 4 minutes, makes that outside surface of the tooth stronger and more resistant to any acid demineralization that the bacteria may produce. It's remarkably effective, and in our practice, we use that we custom design the program, but a minimum of twice a year, a minimum, okay? Right. And it's the least expensive, most effective way of preventing caries today.
So in my mouthwash, I should be looking for one with just fluoride or fluoride included? So
we use, there's fluoride mouth rinses, there's antibacterial mouth rinses, which is probably the bulk of the market, which are mostly for fresh breath, but because if you're brushing well, you're killing most of the bacteria, or removing most of the bacteria to start with. But one of the projects we were involved with is developing a mouth rinse called PeriActive. PeriActive was designed really for your gums. So people with periodontal disease, bleeding gums, people with implants should be using PeriActive, because it works differently than the other rinses. It doesn't just swish around your mouth and kill the bacteria. It does that because that's an important facet. What it does is it's based on botanical materials, and we've maximized their therapeutic benefit through a scientific process. And it actually penetrates into the gums directly to strengthen them and to reduce inflammation or manage that inflammatory process, so that you're not having ongoing gum disease. So people who have a tendency to gum disease or have been treated for gum disease, they should be on PeriActive. Fluoride toothpaste, PeriActive mouth rinse. People with a high caries rate should use a fluoride mouth rinse. The ones that kill bacteria, it's only if you're not brushing effectively, or if you have a fresh breath issue.
Yeah, when I'm at the store and I'm looking for mouthwash, some things will, blare out, no alcohol. Does that matter? Yeah. I mean, I know you said there were 3 different types.
Unfortunately, yes, there were some mouth rinses I don't want to cite any names, but probably the most popular mouth rinse was originally designed. You know, when you used to go to the barber or the hair designer, and they had those bottles with the brush and the combs inside it on the countertop right below the mirror,
Sure.
and it was a colored fluid in there.
Yeah.
That was basically the originator of a mouth rinse. And someone said, well, if it kills the bacteria on your brush and your comb, well, then it might do the same in the mouth. And it did, but it was a high concentration of alcohol, and it dries the tissue out. There are some reports, although that it causes an increase in cancer. There are some doctors who believe that's true, some doctors who don't. They're not large studies, but there are indicators that it will be harmful for you. But it's for sure drying out your tissue and making it more susceptible to periodontal disease, killing bacteria but drying out your tissue. So if you can find an effective alcohol-free mouth rinse, you're better off.
Thank you. And then go back and talk about your product a bit more. It's specifically aimed at gum health.
Yeah, so I mean, I'm a practicing periodontist, and I like to think I take good care of my patients. And I'm looking in the mirror and I'm saying, listen, there's a lot of refractory disease. Refractory disease means you've treated somebody well, but boom, the disease started up in a spot over here and a spot over there. They had some downturn in their overall health, and it weakened their immune system, and all of a sudden they're spinning out of control. How can we help prevent those episodes? Because it's not a small number. It's between 17 to 24%, depending on the study, refractory periodontal disease on an ongoing basis. You have this disease for life once you have it. So that can affect a lot of people's lives on an ongoing basis. So what we did is we started to set up a project where we said, okay, let's use natural products that are known to be safe, but let's make sure that they're designed appropriately so that they're as effective as drugs. Okay, so what we did is we took the natural products, we tested them for years. This is 10, 12 years of research. And we looked at how they would impact on the inflammatory process and how they would impact on the healing process. And we found which elements exactly in which natural products are effective. Then what we did is we designed a special breeding program where we grow the material. We don't actually grow, but we know what we look for. We look for specific markers inside, and we harvest at the right time, and we designed an extraction process from the natural product to your bottle. In a sense, you don't stick the apple in there. You basically have to pull the materials out, and we optimize that material. So we created a formulation which will enable it to hit your gums, penetrate in, and really act on those processes. It'll stimulate your gums to heal and get stronger, so you have an increase in collagen, better design of the blood vessel system and thicker blood vessels there. And then you also have the reduction of the inflammatory process, which is a very complicated synergy of a lot of different biological processes going simultaneously. And you can't just stick it in one spot. You really need to design something that's going to multi-target that and downregulate that entire cascade of activities so that you can get a profound effect. So that's what PeriActive does. I mean, it's many, many years of research, and the product actually works. So.
That's phenomenal. I don't think I've ever heard of anything that's specifically targeted to the gums. How did you, I guess, did you find that you were looking for it and it wasn't out there, so you decided to make it?
Yes. And you know what? It's the, I don't even know what to call it, the naivete of the youth. Well, we need this. Why shouldn't I just do it? I'm a little tired just thinking about it.
And is it sold worldwide? I mean, how
well, we initially sold in Israel, where I developed it, and now it's being sold in the United States. And we're getting enormous positive feedback and rapid growth. And originally, we didn't sell it to the public. We just sold it to dentists. And basically, our orders kept increasing to the point where the dentist kept ordering. First, they would order a box to try it, then they would order 2, 3, 4, and it kept continuing. And during Corona, when the dental offices were closed, the patients were calling the office and saying, well, how can I get this? And we started selling it online, direct to the patient. So now we're going to revamp our entire sales system and sell to the dentists as well, because we treasure those relationships, and the dentist should be providing this to his patients. But more importantly, we want to sell this direct to the consumer because people need it. And whereas we want you to see your dentist for care, and we want you to have someone who's helping you take care of your mouth, most of the work that you need to do has to be done at home on a daily basis. You need something to help you with your gums. For
Is
the
there
50% of the American public over the age of 55.
yeah, that's it's still we're gonna stop this podcast at some point. I'm gonna go back and go 50%. My word, that's not something
Yeah.
that you hear about every day.
No, I
you know,
think it might rate number 2 after the common cold.
oh my word. Well, at least we've got some solutions, hopefully, and a lot of good advice. The difference between oral health, periodontal disease, and inflammation. I have to assume, like every other organ in your body, goes through life cycles, and recovery takes longer. And these things are at times age-based. I guess, disease can start at any time, but are there differences in care or differences in frequency of visits to professionals that one needs to consider as they move into middle and older ages?
So first of all, it's a fantastic question. It's a little bit the response I'm going to give is a little bit complicated because when you're a caregiver, you have to make sure you're taking care of your patients. Now, an elderly or a patient may have some complications also in just getting to your office. So and yet at the same time, if you do get that patient to your office, they may not have the strength and the ability to sit for very long appointments. And they have medical complications, which also impact. So what we have to do is try to take these patients, design a program for them where the bulk of the work can be done at home in a non-threatening manner, which in a sense blends with the capacity that they have. The caregiver has to be brought in, but even regular adult patients have a higher tendency to periodontal disease. And I would say they need to get onto PeriActive as part of their program because that's what we designed it for. It's an easy to use, twice a day rinse. It doesn't impact in any way your life function. Pretty much every age can rinse, and it's safe and healthy. So if worst comes to worst and you swallow a little bit, also not a big deal.
So we're still looking at 6 months, every 6 months for cleanings, even
those days are over, Matt. Those days are over. Yeah, 6 months for cleanings is for cavities. You and I grew up with that. I know.
Yeah.
I know. And it's very funny because I sometimes go back to the early days of fluoride. They said, "Look, Mom, 1 cavity, right? Now this kid is coming to the dentist twice a year. That's 2 cavities a year. That kid on that commercial was 6 years old, 7 years old. That's a lot of cavities. I don't think we were doing so well in preventing in those days." But the thing is that when it comes to periodontal disease, you should be seeing the dentist 3 to 4 times a year.
Wow.
For the dentist or the hygienist. Don't forget, the hygienist is an integral part of this healthcare program. So you may not need to see the dentist that often, but you need to have a professional intervention into the cleaning, as well as cleaning.
And that's so challenging. At least here in the United States, if you have dental insurance, you've got a schedule of benefits that will say, we'll give you 2 cleanings, which backs into that whole 6-month thing. And then once a year, you can have, a more comprehensive oral exam. Doesn't seem like the insurance benefits we're all using is caught up to the times.
Well, I think it's even a little bit worse because there is not a real alignment here in the world of your insurance and their focus and your health and that focus. And I do believe that in time, those 2 programs will meld. How it'll happen, I don't know, because there are a number of countries over the years who have had fantastic public health care programs that worked, except they went bankrupt. So we have to figure out a way to manage that. Greater minds than I are thinking about it. It's really a challenge. And how much do you see the dentist or medical doctor, and how much you don't, what tests to run? You nailed it when you asked the question, because the insurance is definitely not aligned with your health. They have to run it as a business, and they're not wrong. They're not a government healthcare organization. They're a business. And you pay them for a service, then they try to give you that service, but they're not going to over-service you.
So in that case, then, if you've got dental insurance and you've got periodontal disease or the beginnings of it, don't sounds like you're saying don't let the schedule of benefits in your insurance get in the way of you taking care of your oral health, even though you may have to come out of pocket for it if you're going 3 or 4 times a year.
I didn't say it as clearly as you did, but that's exactly what I meant. So thank you.
Well, thank you. It just occurred to me that's a definite that's a break, right? Recommended practice versus the finances that most people
Yes.
who have any sort of dental insurance have to go through.
Yeah.
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 Wow. This has been great. I want to ask more questions that, again, I've used the word elementary 2 times. I'm going to do it again. This is purely from a personal approach. Regular toothbrushes or the mechanized type?
So again, I think it's the mechanized type, or first of all, there are different types of mechanized type. So
Right.
the older ones where they oscillate back and forth horizontally, no good. The ones that oscillate in a circular fashion, they're good. And what they do is they basically put it on the tooth, it oscillates around and does your brushing for you. They work. You can overbrush with anything. Any tool can be overused. But if you're agile, use a regular toothbrush, because why spend the money and you don't need to replace it. Except for when it wears out, it's not a big cost item. Whereas if you have some compromise, or if for some reason or other you're not doing it effectively, your dentist or hygienist may mention it, then switch over to the oscillating toothbrush, the electric toothbrush.
Thank you. One more selfish question, which I bet a lot of people listening are going to wonder too. Teeth whitening. You've got strips, and then there's some teeth whitening toothpaste out there that seems pretty granular. And when I use it, I'm like, I don't know if this is so good for me. It feels a little bit like sand. And then the third piece is mouthwash. I've tried teeth whitening mouthwash before, and it hurts my gums.
Yeah.
It's painful, so I don't do that. What's your take on anything in and around teeth whitening?
So years ago, we thought teeth whitening might be damaging to the teeth and the gums. It's not, if it's done carefully. But you're right, the materials that they use to whiten can cause increased sensitivity. So I think people really are entitled to white our teeth, but the mouth rinses don't work that well. The strips are a bit better. The professional whitening is very expensive. There's actually navigating a new system, which is in the middle of it's just now getting launched and getting ready, but it does work using LED lighting that you can actually whiten your teeth professionally at home. I think that's going to be a big add-on actually to people's overall aesthetic look. It's not a health issue; it's really an aesthetic issue. But so the strips, actually, some people report good effects with. It all depends on how well you place them, what type of whitening. But what you're using, the granular material, is actually stripping off stain from the teeth. So let's say you have a stain that tends to build up on your teeth. Then the granular toothpaste once a week might be a good idea. More than that, you're going to cause some erosion. Okay. You can also do that, by the way, and I take a little bit of baking soda and a little bit of water and just brush the front 6 or 8 teeth with it. It'll take off some of that stain. Don't do it every day, because it can wear the teeth out too. Anything that's granular, it's sort of like sandpaper in a milder form, right?
Yeah, that's kind of what I was.
Your inclination was correct.
When I buy whitening toothpaste, and spend the extra couple of bucks to go, oh, maybe it'll get a couple of coffee stains off. Yeah, I very much so go, this says sand in it. I'm not sure this is good every day.
Well, you were right. So natural intuition is often correct.
So if I buy teeth whitening toothpaste, it'll work, but you're telling me not to use it every day, right?
No. It depends on the whitener. Some of them are granular, some of them are not. Some of them are simply peroxide uses. You know that stuff that people use to make their hair lighter and blonde? Yeah. It's not so different. It's just different types of peroxide. They're all peroxide. So, but don't use your hair stuff on your teeth. I didn't say that.
or the stuff in the barber's bucket, the blue stuff. Don't do that either.
Yeah, that really is a turnoff, I must say.
This has been fascinating. I've learned a lot, and thank you for answering all of my questions, no matter how small or selfish they were. I hope it helps people, and you certainly helped me. So at the very least, I learned a lot. Thank you. What questions about gum disease, and the mouthwash and everything that we've talked about did I not ask that I should have?
Well, we covered a lot of ground, Matt, and we covered a wide range of topics, ranging from prevention and care over different age groups and differences between toothbrushes, etc. But I think one of the most important parts of your oral care is using PeriActive twice a day. And what you didn't ask is, how do patients get a hold of this this mouth
You're
rinse?
right. I neglected to ask that question. So where can people find this?
So
How do we get this?
right now it's available on a website called getperiactive.com. But I think more importantly, I was involved in developing this mouth rinse, and I'm a big believer in it. I have almost all my patients on it. Don't forget, I treat periodontal disease, gum disease, and implants. And so the company actually, after seeing the results and looking at this and the responses from a lot of different dentists who carry this in their offices, is prepared to offer a guarantee. Basically, bleeding gums stopped in 60 days or your money back. So they're pretty confident about the effects here, and so am I.
Wow, that's awesome. Thank you so much for being a guest, and for bringing all of these topics to light. Shocking statistics, some of them. And also I'm gonna go back into my bathroom and poke around my gums a little bit too now. So, and I hope everybody listening or watching does the same thing. It sounds, it's way more important and impactful than I even realized, and I think that's probably true for a lot of folks.
Thank you, Matt.
Thank you
So,
very
and
much.
I did what I hoped I would accomplish. I made this people more aware of what they should be doing.
Yeah, you sure did. Thank you so much for your time.
Pleasure. Thanks, Matt.
The Matt Feret Show, related content, publications, and MF Media LLC is in no way associated, endorsed, or authorized by any governmental agency, including the Social Security Administration, the Department of Health and Human Services, or the Centers for Medicare and Medicaid Services. The Matt Feret Show is in no way associated with, authorized, approved, endorsed, nor in any way affiliated with any company, trademark names, or other marks mentioned or referenced in or on The Matt Feret Show. Any such mention is for purpose of reference only. Any advice, generalized statistics, or opinions expressed are strictly those of the host and guests of The Matt Feret Show. Although every effort has been made to ensure the contents of The Matt Feret Show and related content are correct and complete, laws and regulations change quickly and often. The ideas and opinions expressed on The Matt Feret Show aren't meant to replace the sage advice of healthcare, insurance, financial planning, accounting, or legal professionals. You are responsible for your financial decisions. It is your sole responsibility to independently evaluate the accuracy, correctness, or completeness of the content, services, and products of, and associated with, The Matt Feret Show, MF Media LLC, and any related content or publications. The thoughts and opinions expressed on The Matt Feret Show are those of the host and The Matt Feret Show guests only, and are not the thoughts and opinions of any current or former employer of the host or guests of The Matt Feret Show, nor is The Matt Feret Show made by, on behalf of, or endorsed or approved by any current or former employer of the host or guests of The Matt Feret Show.